Thank you so much. And a little bit of a pulse check for everyone. We are on session 3, and this is the time for us to get fired up again after imbibing all of that rich information for the first part of our convening together. So I'm just so pleased to have this opportunity to introduce what I think is going to be another dynamic session where we really think about how do we take everything we learned and translate it down to what our role is and what we can do in our workplaces. We started off the day really trying to understand what healthcare workers are facing right now. And we had an opportunity to hear a fantastic conversation from Dr. Murthy and other representatives to really get the flavor of the different experiences for each of the different types of healthcare workers right now in our country. We then kind of got an insider's view and really got to learn a lot from 3 health systems with their well-being journeys, both from the leadership level and the frontline level. And then, and thank you so much for the previous speakers, we really got to see that there is a huge tome of resources and activity going on. But how do we take that next step to really go from translating and synthesizing everything we learned to making our workplace environment better? And that's actually the goal for this session. Next slide, please. One of the things that the National Academy of Medicine has done is really try and figure out what is it that healthcare leaders and healthcare workers need and what can we do to arm them so that they can actually start making change now. And so here is a quick slide to show that in January, the National Academy of Medicine synthesized the top resources of evidence-based solutions to really address many of the drivers of burnout and really push us towards a culture of well-being, and produce this compendium of resources. And we just dropped the link in the chat box, so please do take a look as I'm talking. But essentially, we have organized the leading solutions to really make change that's clinically felt by the front lines into 6 essential elements. And so these are depicted right now on the slide, and we'll actually be going into detail with some of them later on in this session. The point for this is that when you return home and you're thinking about what can I do after our convening, this is really one of the first places you can go. And it's really geared towards health systems, but you'll find if you're sitting in a different organization that there's so much overlap that you may find this helpful too. As a quick guide, one website to go to that really starts to break down what can we do within these 6 categories of action, and then find evidence-based links and solutions that you can then adapt to your workplace environment. Next slide. And in kind of thinking about the realities that we face today with workforce shortages, many of the things that we've heard, workplace violence, having really complex patients come in who are very sick, there was also a recognition that while we have many resources, and in fact, we have the research to back up what it takes to help us address burnout present day, there's still a need to have a roadmap. And so in collaboration with the National Academy of Medicine, myself, Dr. Heather Farley, who's actually going to be one of our facilitators, and a group of other leaders, many of which are part of the NAM Collaborative, really tried to hone in on what are the top 5 actions that health systems can take right now. And this is what you see actually on this slide, the 2022 Healthcare Workforce Rescue Package, with the goal of trying to help retain the workforce and stabilize our shortages and address well-being at the same time. So we bring up this additional resource that was, again, developed in collaboration with the National Academy of Medicine to say, we have the research to back up solutions that actually work, that really help drive well-being. And here is where you can start as food for thought. So there also is another link that got dropped into the chat box, and I encourage you to take a look at that to get yourself familiarized and to start thinking about this and maybe take back to your colleagues when you go back to work tomorrow. Next slide. So where are we today? If you'll recall, when you signed up, we actually polled every single person to say, out of all of the 6 priority areas when we think about addressing well-being, what are the top important ones for you? And we actually found that advancing organizational commitment, strengthening leadership behaviors, and cultivating a culture of connection and support really rose to the top. So our breakout session, which is this one, is really going to be focused on these three. And we've actually set up 6 different breakout groups, 2 for each topic, so that we can really get into the weeds and have that dialogue that we've started earlier in this convening and want to really continue. So our goal is not to take a listener mode. Our goal now is to take an active speaking mode role and think about what can each of us do and how do we bridge that gap between everything that we've seen and heard and learned today and take it to figuring out what tactics we can do. This doesn't require us to have a leadership title. It doesn't require us to even be on the front lines. In fact, every single person, whether or not you're a clinician, a public health worker, any type of person working in the healthcare workforce, this is really something where all of us have a responsibility and the ability to make impact. So this is really the time where we turn inward, and we're setting up this session to try and give us that space to have dialogue on what works, what doesn't, and to really start distilling down what we can take home to our organizations. Next slide. So if you'll go back to your original email when you did register, you'll see that you've been given a special breakout link. And so please go back there and go ahead and click on that link, and it'll take you to our chat. We also, in case you are having trouble finding it, we'll also drop these links in the chat, and we just sort of ask that you go ahead and kind of put yourself by your last name in the pre-assigned category. And please note, and this is just a mention from our logistics team, that we do want you to get into the breakout room and then close out of the webinar. And then at the end of the breakout, we'll ask you to return back to this webinar, and that's the current link that you're on. Sometimes there's some feedback when you have both links open, so please do close out of the webinar link. So teams, we're off to the races to figure out what we can do. I'm checking the time, it's 2:58 Eastern, and we will go ahead and conclude our breakout sessions at 3:25 Eastern, and then resume. We'll have a 5-minute bio break, and we'll resume our report out and the rest of our convening at 3:30 p.m. Eastern. So with that, see you soon and enjoy the dialogue. All right, everyone, welcome back. I'm sure there are going to be a few others trickling in, but we'll go ahead and start. And I think the first take home, at least for me, is that our breakout session was too short. We were just getting into the meat of, you know, what the problems are, what we're feeling, what we're digesting, and what we can do. But let's give it a crack. This next session, for session 3, is really about trying to have everyone sort of report out as to what their own groups talked about. And so we're going to start with one of our first themes, which was advancing organizational commitment. And I'm just going to ask Dr. Pam Cipriano to go ahead and give us a quick snapshot of what you spoke about in your discussion with your group. And just a note for all the facilitators, we're trying to keep to about 5 minutes so that we can give everyone some time to speak. And you may get a gentle nudge from me or from one of the staff members about that. And with that, I'll go ahead and give it to Dr. Cipriano.
So Tina, this is Art Hengerer. Pam's line in the whole city of Charlottesville is out at the moment. So she was delayed getting on with us and was going to try and call in. So till she does, let me quickly summarize a little bit about what I heard as we talked. And we talked a little bit about the barrier that really in a lot of systems still getting the C-suite leadership to really understand and buy into what needs to go on for the staffing is a problem, but there isn't adequate vocalization from the ground up to really pull them into that yet. But when you get a critical mass and get their attention, you can make some movement happening. That having the rounds with the executives going around that Jay Kaplan talked about earlier today seems to really make a difference. The issues around when staff begins to talk and know what they can do to really help the system begin to thrive and change, that begins to create a win-win situation and gets the attention of leadership and breaks down some of the barriers. And also that when systems decide to do surveys, that it's important to really take that information from the survey, analyze it, and be transparent and share it. It's what helps build the trust that Dr. Murthy was talking about earlier. So we had a little bit of a limited discussion because of the technical problems, but I think those were the highlights that that I heard as I was taking the notes.
That's great. And Art, just one more question for you. You may have already answered this, but if there was just one thing that the group was honing in on that potentially could be done, what was the one thing?
I think the big thing that I heard is really finding that mechanism of how you communicate between the leadership, and it's that communication of the understanding of, here's our problem, we understand your problem, but the communication still has a ways to go.
Thank you so much. And that is just, it's such a hard nut to crack. I think that's every industry problem. With that, I'm going to go ahead and actually turn to Sarah Delgado, who led the other group, also focused on what can we do to advance organizational commitment. Sarah?
Thank you. Thank you, Tina. We also did touch on trust as a key issue, Art. So it's interesting that your group came to that as well. We actually, on a positive note, in our poll, what we found was that actually 59% of the participants in my small group felt that one of the things their organization is doing well is embracing well-being as a shared organizational value. And I felt positive about that number was as high as it was. So we talked about a little bit what happens, what makes that happen, how does that work? And some of the ideas that my group shared were the importance of being really explicit about well-being as a pillar, as a foundational element. Also bringing together groups, and not only that process that Dr. Murthy and Art touched on of listening to each other, but before you begin the work, to develop a shared understanding of what success is going to look like, making it clear what the shared goal is, and that everyone is here to work towards that goal, even though there's going to be different perspectives and different expertise that are at the table. And then we also talked about building trust, and one of our participants talked about the importance of adjusting dialogue for different groups. So if you're speaking from a place of sort of the middle and you're working with frontline staff and also working with folks in the C-suite, being able to adjust your dialogue to address what is important to the group that you're working with at that moment. And I thought that was an important point. One of our members brought up the recent survey by the American Nurses Association, which is open access online, and really demonstrates the magnitude of the challenge before us in terms of building trust between nurses and organizations. So if you haven't seen that survey, I encourage folks to check it out because there is some really valuable data there. And then we also talked about some of the concrete things that need to change for organizations to demonstrate their commitment to advancing well-being. One of the ideas was around the fact that we lump PTO for vacation and sick time together often, and people have to earn it. So you start out at 0 hours and you have to earn it as you go. And is there an opportunity there to demonstrate the importance of time off in a different way for well-being? And then the second sort of concrete idea that came forward was around how we talk to people about their well-being, and almost having some specific conversational tricks. The one that was presented was asking someone, what's your battery at? So when you ask someone, how are you? There's kind of a default to say fine. But if you ask someone, where's your battery level today? It kind of encourages more of a honest self-reflection of really, what do I have to give in this moment? And what do I need in order to be able to maximize my contribution? I think that was everything.
I think that's fantastic. And I have to say, listening to you, I feel like my battery is getting recharged a little bit, especially when you talked about PTO and vacation. These are basic foundational things that everyone, whether you work in healthcare or not, really needs, especially because we've been dealing with the pandemic for this many months. I think that's great. Well, let's go ahead and transition to the next group. These next two groups actually focused on thinking about how do we strengthen leadership behaviors. And I want to go ahead and turn it over to Dr. Kirk Brower.
Yes, hi, thank you. In our poll, two things were greater than 50%. One was well-being as a shared organizational value. And we thought this was a good start, but it also needed to be a daily practice, that values are good, putting them into action is even better. And then help for stress reduction and mental health is readily available. More than 50% said that was also true of their organizations. And again, I think that's very valuable. At the same time, it is an individual level intervention. It's something that the organization may make available, but it's still on the individual to be resilient and mentally healthy, and it doesn't really address the drivers of burnout. So those things we think are necessary but not sufficient. What was the key was communication with leadership, two-way, transparent leadership. And we talked about a few ways to make that happen. One was through the leadership rounds, which everyone thought was a great idea, and the importance of putting those rounds on the calendars of the leaders, because if it's not on their calendar, it's not going to happen. And that would go for our own breaks as well. And the other way of communicating is to have data. And that's where measuring leadership behaviors was so important, such as through the Mayo Clinic leadership, or designing your own questions to put on your annual survey. And the importance is that then that has to be fed back to the leaders, but it has to be done so in a kind and compassionate way, with the idea that we measure to improve, not to judge. And that it's good to have the data, but if the data doesn't translate into some kind of action, then that's the next important step, is to take action on those data. Another way, so that's another way of communication, is by feedback to leadership. And then finally is to work with leadership about their communications about well-being. When they message us in their emails, their weekly or however often, that sometimes those messages can be tone deaf. It was good to be called heroes during the first surge. If leaders call us heroes now, it will be tone deaf and people will resent it. So how do we help our leaders communicate about well-being? Thank you.
That's fantastic. And, just a follow-up question, because I'm sure many are like me listening in thinking, of course, we absolutely need two-way communication, but I haven't seen my leader. Sometimes I get that email and, they've signed it at the bottom, but they never come around to my unit. So how, thinking about that, and then thinking about, we need to measure leadership behaviors. How do we actually make it safe enough for leaders to actually say, hey, I recognize I have a contribution to well-being, that I need to maybe develop some tactics? How do we make it safe for a leader to say that?
Well, we did talk about how to get leaders buy-in on such data. And that was that we know connection with leadership is linked to retention, and that we are currently in a time with staffing shortages that we cannot afford any more attrition. And with greater attrition, not only will the workforce be less well, but the organization won't be able to meet its goals, including its financial goals, because there won't be anyone to see the patients.
I think that's a great call out. I think tying it back to attrition and workforce shortages, it's something that is a universal language, no matter what hat we happen to be wearing at that day. That's a great call out. Thank you so much, and thank you to your group for that great dialogue. And now we'll go to our last group, of which there are two, really focused around cultivating. Oh, actually, my mistake. I missed your other partners. I'd like to introduce Dr. Lucinda Main to also talk about how do we strengthen leadership behaviors.
Thanks, Tina. I was going to just say ditto in a way, but there are a couple of points that our group made that have not been communicated yet. And one of them is the recognition that while this is a very, very complex thing, it also has to be addressed locally. And consistency across units within an organization and across an organization. I was really struck by the Mount Fiore speaker who talked about the fact that, you know, right now wellness is doing best around the core, you know, but they have 11 other systems in their system or units in their system. And so striving for consistency does really require a lot of attention at the top. And that we really need a collaborative approach, public-private approaches to collaborating to address enhancing workforce well-being. And the last point that you called out about staffing shortages, it's a vicious circle. One of our people who lives in a rural, works in a rural context, talked about the fact that while they are struggling just to fill vacant positions, it gets really hard to keep prioritizing wellness. But if you don't prioritize well-being, then you're going to have attrition and you can't get yourself out of that hole. I think that deciding what is really working for your organization, rather than running after shiny objects and thinking that you're going to just try this and then we're going to try something else and then we're going to try something else, is probably not going to lead to a wholesale improvement in staff workforce well-being. And then sort of two sides of the coin. I think that leaders must be able to address this in their authentic voice. So it doesn't sound canned or tone deaf, but that leaders also need to understand that just because you may have a chief well-being officer for your system or a component of the system, that doesn't mean that they delegate the responsibility for this to that office. It's kind of the same with DEIA. Yes, you need a chief diversity officer, but every leader needs to embrace their role and responsibility in this area for it to really have a sustaining culture stamp for them and for their organization. So those are the top points.
Oh, those are really great points. And I love how you talked about collaborative approach and thinking about public-private approaches. You know, one thing that strikes me, in addition to how I think our country, at least in healthcare, is starting to approach diversity, equity, and inclusion, but if we take a page from the patient safety book, I think there's, you know, most people have chief quality and safety officers or divisions and many other people that may be involved. But the truth is every single person that walks into a care setting is a safety and quality officer. And how do we change the game to where every single person that walks into a healthcare system is a chief well-being officer and is responsible? And I'm just curious if that's triggering any thoughts for anyone that's listening in. We'd love to hear. Please go ahead and drop something in the chat box if so. Lucinda, I just wanted to follow up on one thing. What if you're a leader that's burnt out? Because I think that's probably the majority of the case. How can you navigate a topic that's incredibly complex that you don't want to make a mistake on and try and have that authentic voice to communicate to your, you know, to your people?
You know, it's a great question. And the thing that comes to my mind is that we have a responsibility to watch out for each other. And I think it's hard, if you're really burnt out, it's hard to hide. And so I think someone else in the C-suite on your team needs to encourage you to get some help, whatever that might look like. And hopefully it's easily accessible, within your model. But leaving it unaddressed, unspoken, is not in the individual's best interest, nor in the best interest of the organization or anyone else that's depending upon them to be healthy.
It's almost like having the courage to say that you're burnt out, which even for many of us that have been working in this space is often challenging when we're in our day-to-day jobs and we almost deny it. But I love that call out. That is an incredibly challenging thing to do in our culture.
I'm using weary, which I know is not the same as burnout, but it's maybe not quite as laden. And I'm admitting to people when we have a conversation that I'm weary. 2 years is a long time. So thank you.
Well, thank you for your courage to be weary. I think many of us feel the same way. And let's go ahead and actually change to, I think, not the solutions, but a discussion building off of this thread of how do we cultivate a culture of connection and support. And let me go ahead and turn it over to Dr. Heather Farley to kick us off on this one.
Hi, Tina. So as you said, I felt like there was not nearly enough time to have the conversation that we wanted to have in our group. We had so many great ideas in a very engaged group. But I think two key themes or takeaways that I'd like to highlight from the discussion, and then a couple of innovative ideas that came out. So one of the themes that arose, I think, was the importance of embedding well-being efforts into the actual workplace and sort of hardwiring that into the system. Whether that's a person, so bringing EAP on site, or a mental health professional of some sort who can be seen as an ally and supportive and part of the healthcare team. So it could be a person, it could be time. So you're embedding that time either during or onboarding, during residency conference time, protected time, during staff meetings. So rather than having well-being something that's done on off hours, on your own time, bringing it into the workplace. And then also, considering opt-out options rather than opt-in options. And the discussion around this was those sort of, that approach helps to decrease the barriers to help-seeking behavior. The second major theme that came out of the discussion in our group was around peer support. A lot of peer support programs and supporting caregivers after adverse events, or even more broadly in terms of supporting one another in our day-to-day work. So many felt that this was truly a foundational component of a strategy to cultivate a culture of connection and support. And we talked through some of the barriers to that, but definitely most people on our group felt that that was really, really something important for organizations to focus on. And then two of the, I think, innovative ideas that popped up during our conversation. One was around, you've probably all heard of Schwartz rounds, but someone mentioned that they do impromptu Schwartz rounds, which enables them to really flex and respond to the rapidly changing needs of the workforce. So they kind of flex it as needed. I thought that was really cool. And the second innovative idea was something that called third conversations. So many of us have heard of those commensality groups or compass groups, where we bring clinicians of various backgrounds together to have a facilitated discussion over a meal and develop that that sense of teamwork and mutual support. But with third conversations, you're bringing clinicians and patients together to do this, or clinicians and administrators together to do this. That last one really got my attention. I would love to do that. So those were some really cool ideas that came out from our discussion group.
That's really fantastic. And I'm just curious for folks that are listening in, thumbs up if you are able to put your thumbs up. This might only be appropriate for the speakers, but thumbs up if you think in your institution that you could bring clinicians and administrators together. I think that's a fantastic idea. It goes back to a theme that's been running through our entire time together today, which is how do you build trust? And I think that's one big step. Heather, I wanted to ask you a question, because I know you're Chief Wellness Officer. You've done considerable amount of work in this space. What would it take to get us from, and I think many of our groups did that poll earlier, But what would it take for us to get from 50 or 60% on some of the 6 priorities to 80%? Can you imagine a place like that? And how long would it take us to get there?
Yeah, that's a great question. And I think it really does take this holistic approach that we've all been talking about today. So it's not just a top-down approach, and it's not just a bottom-up approach. So and the silver lining to the last 2 years, I think, really has been that a spotlight has been shown on how important it is for health systems to invest in the well-being of our workforce, of our caregivers. And so I think there is renewed interest to do this work on the part of health systems and on the part of all of the other components of that impact health systems. So government and regulatory bodies and the general public. So I think there's broader awareness now. So I really feel like this is a bit of a tipping point for us. And how can we capitalize on that and really continue that forward momentum from that grassroots and top-down approach?
That's great. Thank you. And thank you for indulging me and putting you on the spot there. We needed to spice it up for a moment. And with that, I'll go ahead and actually transition to our last group and just ask Dr. Ernest Grant to give us his perspective on the discussion in his room.
Well, thank you very much, Tina. And like every group, there has to be an outlier, and mine was the outlier because I had trouble logging on, and we didn't get the chance to do the poll. However, there was some very interesting dialogue that was put forth, mainly around asking the group what still needs to be done, given that everything that they have heard. So just a quick summation of the notes. One, enough staff to do the work, especially among nurses. That staff are not being listened to, and I find it really amazing that a lot of our comments, even in the chat, has to deal with things we've already talked about today, such as centering around conversation or communication. That theme just keeps cropping up more and more. Having a safe environment, documentation time, safe spaces for connection or support. We need to include more of that. Biases in the workplace, in addition to other system biases, especially among women, or biases towards women, I guess I should say. Burnout, talking about being burnout and working on burnout. We had a very interesting dialogue about that. And one of the things that was associated with that was Maslow's hierarchy of needs. And if you really think of how that applies, with Maslow, you got to take care of yourself before you can take care of others. And I think that's something that we sometimes all of us in healthcare are sort of reluctant to do. We need to think about safeguarding our clinicians' well-being so that we can be there for others. And part of that means, as we sort of talked about, maybe tapping someone on the shoulder and saying, take a few minutes out and go to that room where you can recuperate or whatever, and not have stigma associated with the fact that you are doing that. And so just a couple of things in the chat. There was more C-suite presence and conversation, less talk, more implementation of ideas, talking with clinicians about what they really need. Makes safe space known for folks that do not feel that they have it in their institutions. And then addressing stigma and seeking help or discussing burnout or mental health issues as well. So I'll stop there because I know we're at a push for time, but I thought it was interesting though that there does seem to be that constant theme of conversation or communication and interprofessional collaboration all the way around.
Yeah, and I love that you ended on that note of thinking about communication. And if we take it even more broadly, and I know Dr. Murthy has talked about this, but misinformation plays a role too. And whether we're talking about vaccines and what the actual science is with COVID management and treatment, or we're talking about just the lack of understanding of maybe what our leaders are doing, or our leaders not understanding what we're facing, it kind of all goes in that same bucket of there's just a lack of clarity. And I'm just wondering, how do we take it back to basics? It's making me think about President Roosevelt and fireside chats, but how do we do that in this tech-enabled world? Speaking of tech, which causes us burnout in and of itself.
I think, just a quick response to that is that we do need to go back to the basics and figure out, but the question is getting people willing to go there. I don't know if, the old saying, sometimes you have to hit rock bottom before you begin to, really start all over again. And I think we have either hit rock bottom or we're close to, close to it. So that may be the opportunity to press the reset button. And while we're resetting, let's not forget to look at what put us in this place. Long before COVID came along. I mean, COVID accelerated things, but I think we were well on this trajectory, and I think we just sped up at the very end and really hit the brick wall. So I think it's an opportunity for us to set back and rethink and go along the path of, how do we get started down this path, and how do we put in safety measures to ensure that this doesn't happen again in another, 2 years or 5 years or 10 years or so, but that we know that we built in some safety measures.
Absolutely. And I think that last statement that you made, Dr. Grant, is just, it's on everyone's mind. I know at the federal government, there are conversations about how do we arm our health workers so that they can, because they are pretty damn resilient. In fact, all the research shows that we are more resilient, and that's not the problem. It's just when we're put in an environment that doesn't set us up for success, and how do we make sure that doesn't happen again? I think that's right on point.
Yeah.
Well, I just want to say thank you to all of the note takers and facilitators and staff, as well as participants. We're getting close to the end of our session together, and I wanted to throw something out there for everyone. And this is one of those gold star moments, because when it comes down to it, I suspect most of us are competitive. We want to take action, we know how to take action, and we love getting gold stars. And here is how you can get my gold star, at least, is this. We've had nearly a whole half day thinking about what the issue is, what the challenges are, and what the solutions are. And if you're ready to commit to something, whether it's something for your own well-being action plan, or something that you think you can do to affect your workplace environment, I'd love for you to drop it in the chat, because we are a community together. And even your one idea may trigger ideas for others that are listening. So get that gold star and put something in the chat box. And I want to take a moment and kind of just, as we wrap up, quickly summarize, because there were so many rich comments, and I'll just kind of pull out a couple that really hit home with me. One is really about needing a critical mass to then really get C-suite leadership buy-in and connection. And so sometimes there's power in numbers, and using power in numbers to find a way to connect back to leadership. I think the underpinning of that is trust. And how do you build trust? Whether you're a leader and you're rounding on staff, or whether you're someone on the front lines and trying to build trust the other way around. Another thing is really the importance of how we communicate the message. And I think this goes back to comments that have been made earlier today, where sometimes we communicate with different jargon, with different words, and how do we find the right words for our audience, and thinking about that. And really, it comes down to helping health workers really to understand what their needs are, because for the most part, we're focused and we know what we need to do our jobs well, but we just need the help and resources to get that. And then last, I would just say, I think the fact that we're still in yet another month of the pandemic, it just tells us that all of us are really at risk of burning out. And whether we are actively taking care of patients, we're working in public health, we're working in administration, we're all in the same boat. And sometimes we have to look within and acknowledge that we're weary, or acknowledge that our batteries are low, and then lean on others so we can get the time to build up our ability to then address well-being for our colleagues too. Well, this has really been just a fantastic session, and I think it's really the capstone as we've gone through the day, just listening and learning and understanding the experiences of others. I just want to say thank you again for everyone that participated, and a special thanks to the NAM staff, which I think this was like a heroic feat to come and take such a large group and break us into 6 groups and then help us come back. So thank you so much for that. And I'd like to go ahead and just introduce the speakers for the next session now. And I'll turn it over to Dr. Pam Cipriano, the Dean of the University of Virginia School of Nursing, and Dr. Neil Busis, the Associate Chair of Tech and Innovation at NYU Langone Health. Thank you.